the Caribbean Public Health Agency, which is to be headquartered in Trinidad and Tobago. After the signing, University of the West Indies Chancellor Sir George Alleyne spoke about the significance of CARPHA.
This has really been a magnificent moment. It has been the culmination of years of work, of years of negotiation, discussion. 10 years ago in Nassau, the Caribbean heads of government had their famous declaration, the health of the region is the wealth of the region. And this is another example of how the Caribbean countries have looked at health as being contributing to their particular wealth. This ceremony of signing brings into existence, the legal existence, the Caribbean Public Health Agency. And the Caribbean Public Health Agency really constitutes a collective Caribbean response to the major public health problems of the Caribbean. This is the first time we have been able to pull together the parts of our public health response into one particular agency. The contribution of the Pan American Health Organization, and I bring you regards from Dr. Roses, the director, the seminal contribution of the government of Trinidad and Tobago, the leadership of Prime Minister Douglas, the participation of the CARICOM Secretariat, particularly Dr. Edward Green, have all culminated in what has been a really marvelous occasion, a really important occasion for the Caribbean. What will CARPHA do? What CARPHA sets out to do is to identify those public health problems that are common throughout the Caribbean and how one can pool the public health resources to have a focused response to the public health problems of the Caribbean. That is what it really means for us. It is really a tremendous advance. And to bring it into place today, for many of us, is a very emotional experience.
Sir George emphasized the relevance of CARPHA to CARICOM citizens.
The average citizen in the Caribbean knows, each one of us knows someone who has diabetes, each one of us knows someone who's had a stroke, each one of us knows someone who's had some heart problem. One of the things that CARPHA will try to do is to try to pull together all of that information about what is happening in these various areas so that we can craft a collective response to it. In what sense do we need a collective response? Some of the issues that are being discussed now in relationship to these diseases will need for the Caribbean countries to work together, and that is one of the things that CARPHA will do. So if you ask the average citizen, why is CARPHA important? You will say to that citizen, the fact that your child does not get poliomyelitis, the fact that your child is properly immunized, the fact that there are many of the medications that were made available for some of the problems you suffer. When there's an epidemic outbreak, who will respond to this epidemic outbreak? That is what the Caribbean citizen must know about CARPHA, an agency ready to respond to their problems.
Sir George also noted the link that CARPHA will have with other Caribbean agencies and institutions, including the UWI.
There's always been a close relationship, and not quite symbiotic, but a close relationship between some of the major institutions that are being pulled together and the University of the West Indies. The 5 institutions that will be pulled together are the Caribbean Epidemiology Center, Food and Nutrition Institute, Environmental Health Institute, Public Health Laboratory, and the Caribbean Research Council. And there's always been a good relationship between the university and these institutions. I think what you'll find is a much closer relationship between CARPHA as one entity and the University of the West Indies in its teaching function as well as in its research function.